हेलो एवरीवन, मेरा नाम अश्मिता है और आज इस वीडियो में हम बात कर रहे हैं अबाउट द क्वेश्चंस फ्रॉम द नर्सिंग एग्जाम्स। तो चलिए स्टार्ट करते हैं, क्वेश्चन को देख लेते हैं क्या क्वेश्चन है। यहाँ पे बेसिकली हमें मल्टीपल चॉइस क्वेश्चन दिया गया है और केस को स्टडी करके हमें जो सही आंसर लगेगा वो हमें चूज़ करना है। तो जो फर्स्ट क्वेश्चन है वो बताते हैं कि मदर ऑफ अ 3 week old infant टेल्स द नर्स she is residing in a homeless shelter and is concerned about her baby's mild cough, poor appetite, low grade fever, weight loss, and fussiness over the past 2 weeks. Which nursing intervention would be the nurse's highest priority? तो फर्स्ट जो प्रायोरिटी है वो बताते हैं कि weigh the child to have an accurate weight using the standard precautions. सेकेंड, ओके, फर्स्ट को ही हम डिस्कस करते हैं. weighing the child would be important but it would not be the of highest priority when concerned about an infectious cause. So initiating droplet precautions to prevent the infection or prevent infecting the others would be a priority. Then weighing the infant would come. So इसको हम सबसे highest priority नहीं मान सकते हैं. आते हैं सेकेंड पॉइंट पे. reassure the mother that the baby may only have a cold which can last a few weeks. सेकेंड पॉइंट को डिस्कस करते हुए, the symptoms are not suggestive of a cold but of something more serious. Infants do not usually lose weight nor are they irritable with a simple cold, but they can be fussy. तो ये हम कह सकते हैं कि ये सेकेंड वाला भी हाईएस्ट प्रायोरिटी में नहीं जा रहा है. Third, immediately initiate the droplet face mask precautions and isolate the infant. देखिए, children with tuberculosis may have a history of living in a crowded home or could be homeless. Other symptoms may include a cough, cold symptoms, low-grade fever, poor appetite, fussiness, and exposure to a person with tuberculosis. तो ये जो इनिशिएशन है ऑफ ड्रॉपलेट प्रिकॉशंस एंड आइसोलेशन ऑफ द इन्फेंट वुड बी वारंटेड इन दिस सिचुएशन. सो ये बिल्कुल हाईएस्ट प्रायोरिटी में हम देख सकते हैं, इसको हम कंसिडर कर सकते हैं. नेक्स्ट है taking a rectal temperature while completing the assessment using standard precautions. So taking the infant's temperature is important, but initiating droplet precautions would be the very first priority, जिसको हमने already choose कर लिया है, third वाला point. Next question, which would be the priority nursing intervention for a newly admitted child with Kawasaki disease? कार्डियोवैस्कुलर जो ओके, फर्स्ट पॉइंट को हम देख लेते हैं. कंटिन्यूअस कार्डियोवैस्कुलर एंड ऑक्सीजन सैचुरेशन मॉनिटरिंग. देखिए, कार्डियोवैस्कुलर मैनिफेस्टेशंस ऑफ द Kawasaki disease are the major complications in pediatric clients. So continuous cardiac monitoring is required to alert the nurse of any kind of cardiovascular complications. And decreased this oxygen saturation and respiratory changes have been shown to be the early indicators of all the potential complications. तो हम first point को consider कर सकते हैं. Second जो है वो बता रहे कि vital signs every 4 hours until stable. Vital signs would be taken every 1 to 2 hours until stable on a new admission with the Kawasaki disease. तो ये उतना ज़्यादा नहीं जा रहा है. Third, strict intake and output monitoring hourly. Strict intake and output monitoring बहुत ही important है, लेकिन because the major complications with Kawasaki disease are cardiovascular, continuous cardiac monitoring is of the first priority. तो ये भी नहीं जा रहा है. Begin the aspirin therapy after fever has resolved. High dose of aspirin therapy is begun and continued until the child has been afebrile for 48 to 72 hours. Then the child is placed on low dose therapy. So ये भी नहीं जाएगा. Next जो चीज़ है वो है which clinical assessment of a neonate with bacterial meningitis would warrant immediate intervention? Irritability. With the diagnosis of suspected bacterial meningitis, the neonate is expected to be irritable, with frequently accompanies which frequently accompanies increased intracranial pressure. तो ये irritability नहीं जाएगा. Rectal temperature of 100.6 degree Fahrenheit, rectal temperature of 38.1 degree centigrade or 100.6 degree Fahrenheit indicates a low grade fever and is not as concerning as the slower than normal respiratory rate of 24. तो ये भी नहीं जाएगा. Next है quieter than usual. So the fact that the infant is quieter than normal is in response to the slow respiratory rate and sepsis the neonate is experiencing. तो ये भी उतना नहीं जाएगा. Next है respiratory rate of 24 breaths per minute. एक नॉर्मल नियोनेट्स का जो रेस्पिरेटरी रेट है दैट इज 30 to 60 breaths per minute. नियोनेट्स का जो रेस्पिरेटरी सिस्टम है वो बहुत ही इमेच्योर है एंड द रेट में इनिशियली डबल इन रिस्पॉन्स टू इलनेस. अगर कोई इमीडिएट इंटरवेंशंस चालू नहीं किया गया when there is respiratory distress, then a neonate's respiratory rate will slow down, and the respiratory distress will also worsen and eventually respiratory arrest will occur. So neonates with slower or faster than normal respiratory rates are true emergency cases. They require identification of the cause of the distress. So ये बिल्कुल जा रहा है. Let's take the next question. An 18-month-old is discharged from the hospital after having a febrile seizure secondary to exanthem subitum, that is roseola. On discharge, the mother asks the nurse if her 6-year-old twins will get sick. Which teaching about the transmission of roseola would be most accurate? पहला जो है वो बताते हैं कि the child should be isolated in the home until the vesicles have dried. The rash जो है ना, the rash is pink and maculopapular, not vesicular. So incubation period जो है, it's 5 to 15 days and it's more commonly seen in children between 6 months to 3 years of age. So isolating the siblings is not necessary, okay? Second, the child does not need to be isolated from the others, from the older siblings. Yes, that is what I told in the very first option. तो ये बिल्कुल सही है. The route of roseola transmission is unknown till now, and the disease is more commonly seen in children 6 months to 3 years of age. So siblings do not need to be isolated. Thirdly, administer acetaminophen to the older siblings to prevent seizures. Because the siblings have no history of seizures, it is not necessary to administer acetaminophen to prevent the seizures. Okay, तो ये गलत है. Lastly, monitor the older children for some seizure development. तो febrile seizures जो है, they are not usually seen in children older than 6 years. And because they have no history of seizures, it is not necessary to monitor them for seizure development. Okay, तो ये भी उतना नहीं required है. Next, the pregnant mother of a child diagnosed with erythema infectiosum fifth disease is crying and says, "I'm afraid Will my unborn baby die? I have a planned cesarean section next week. Which statement would be the most therapeutic response? फर्स्ट वन बताया जा रहा है कि let me get the physician to come and talk with you. Having the physician come back and talk with the pregnant mother of a child with fifth disease is appropriate, but these are certainly concerns the nurse can address by using therapeutic communication, so no need to call the physician. First one. Then second one, I understand, I would be afraid too. Acknowledging the mother's fear is therapeutic and it is like appropriate to intervene. Okay, so no. Third one, would you like me to call your obstetrician to have you seen as soon as possible? Informing the obstetrician would be appropriate after dealing therapeutically with the mother's concern. So, yeah, okay, but we need to know the most therapeutic response. Last one, I understand you are afraid. Can we talk about the concerns? Yes. See, there is less risk of fetal death in the second half of the pregnancy. So it is more therapeutic to acknowledge a client's fears. After acknowledging her fears, the most appropriate response would be to discuss the concerns and clarify any kind of misconceptions. So yes, go with the very last point, that's the fourth point. Okay, we are going to keep this video discussion till here, question paper discussion till here. If you want to prepare for any kind of entrance exams or government job exam preparation, you are doing any kind of exam, then you can take the help of our classes. हम यहाँ पे आपको study materials provide करेंगे, live lectures provide करेंगे, recorded lectures portal access would be there, and like mock test facilities, then this डाउट क्लियरिंग सेशंस, तो प्रीवियस ईयर्स के क्वेश्चन पेपर्स भी प्रैक्टिस पेपर्स भी हम सॉल्व करेंगे. तो अगर आपको ये सब फैसिलिटीज़ चाहिए तो आप हमारे क्लासेस में ज्वाइन कर सकते हैं. उसके लिए आपको जस्ट नीचे दिए गए डिस्क्रिप्शन बॉक्स में जाके चेक करना पड़ेगा. हमारे बारे में सभी डिटेल्स, कॉन्टैक्ट डिटेल्स, वेबसाइट लिंक सभी दिया गया है. डू कॉन्टैक्ट अस, एंड अगर आपके मन में कोई भी क्वेरीज है तो आप कमेंट बॉक्स में पोस्ट कर सकते हैं. थैंक यू फॉर बीइंग विथ मी टिल द एंड. चलिए मिलते हैं अगले वीडियो में.